Thank you, Divakant, and for giving me this opportunity. And so, this talk is going to be, let's not show the topic right now. Whatever you are seeing is the background there. So, I am Dr. Vaitheeswaran, and I am a consultant in Narayan Nethralaya currently. So, if we know the topic, then our minds are streamlined to a particular set of thoughts. If you do not know the topic, then it's easier to convince a different set of thoughts than what you're expecting. So let's look at a broad overview of this topic that I'm going to speak about. It's going to be on 4 areas: disclaimers, journey, my understanding of how it has to be done, and finally it comes disclosures. So disclosures are usually an initial part of the presentation, but for my own convenience sake, I have added towards the end. But let's start from the disclaimers. So some things would be fun, some things would be serious. So no insects were harmed in the making of this presentation or on the journey. And it's an obvious fact that there are many in the panel, many in the audience who have definitely accomplished a lot more than I have at this stage. And I'm absolutely not one yet. So this is a broad disclaimer at the beginning. So it's not to offend anybody's ideas about what international fellowships or shifting internationally is all about. It's about just my perspective and what I have done. And see, success is absolutely personal, and but it follows certain universal rules. So if I have to say what I have done is success, it's wrong. If I consider somebody else to be successful, it's wrong. Success is completely personal. If you want something and you get it, it's a success for you. If somebody else doesn't get it, it's not a failure for him. So success is something that's not personal. So just don't look at it from that point of view. But let's discuss the common rules that are required to do that. And other people may have some personal experiences about international fellowships, as I'm sure they have. And it would be different as well. Some would want it, some would say it's not good, some would say it's at this stage you should not do it or whatever. But if you feel so, my sincere apologies, because I can speak only about whatever is my experience. And I would be alluding to some gods in between, and I am neither a pseudo-liberal or a right-winger, and that's a broad disclaimer in the beginning. And many people would have the questions as to, if you are opting for international fellowship, if you have got selected or something, then what about after the fellowship? So this talk is not about what after the fellowship, it's about how to get in there. So the reason why I'm here is because of the journey that I undertook a year ago. And so that journey took me here, and it has brought me here to the States to speak about the journey. And to start in broad about what the journey is all about, our lives start in 4 different stages. So the first stage is all about survival. So where you are, fighting for your daily bread and butter, and this is a snapshot from a movie where somebody is stuck in an island. So that kind of situation we are not in. The next stage is where you have a decent Tata AAG life insurance and a good umbrella cover on your top, and you are in a state of security. And most of us are even born in this state. So we are neither fighting for survival nor for security. The third stage is where you are off for a weekend to Hawaii, or you're sailing your cruise boat in Goa in the weekends and spending a few lakhs of money that you need. That is a stage of success, or a stage where you have more than what you desire, more than what you want, you have what you desire as well. So this stage of success is also, as ophthalmologists, close to 30-40% of them attain this level of success, and others remain in security. But what we all should strive for is this stage where we have some significance in the field in which we are working. So this is about, success is about a personal thing, whereas significance is about what you're leaving behind, or what you're adding to the field, or what would you be known for by the time you're done with the field. So this is what we should be striving to work for, and this is what made me consider an option to go international. So let's go to my journey. If you look at this journey of USMLE, which I started last year, so this journey, initially I was really, I was in multiple minds as to take this or not, because I was close to 8-9 years after my MBBS, and I had really, my knowledge as to the location of thyroids versus parathyroids versus pineal gland was all in one, I often used to misplace the parathyroids or the thyroids in their locations. So that was the level of knowledge with which I had to start. So it was all totally different. And if you looked at the types of cases that I had to know to actually look at or clear USMLE, was from, say, a nephrotic syndrome, gastroenteritis, child abuse, to dysfunctional uterine bleeding, to toxic shock syndrome in menstrual cycles, and all kinds of things which we hardly remember, or even we hardly read during our MBBS times, to be frank. And acute pericarditis, or PCP, pneumocystis carinii pneumonia with hypertension. So these are things I had to start in the beginning. So it's really tough. But then I asked myself one question: am I adrenergic or dopaminergic? So I broadly believe there are 2 kinds of people. So those people who have pleasures in completing everyday's task at the end of the day and have a release of dopamine in their, the dopaminergic neurons in the brain and feel pleasure out of that. So those are people who work long-term, work every day and have expectations of results at the end of, say, a month or 2 months or a year or so. They are all people who work on dopamine. Whereas there are other people you say, you tell them in the morning that I need this work to be done by the evening today. And a lot of adrenaline releases and they complete the work. So I find that I found out myself that I was adrenergic. So I could not wait for a really long time to take up the same task that everybody does. So I felt my adrenaline could be put to use. So what I did was I had a really extensive plan. So these are all some sheets in my rough note where, you plan before April 15th, do this, do that. And if you look at even, have to finish these topics and onward flight to US, what all I'll read, and the return flight, what all I should read. So this is the extent of planning that goes on, but eventually, I take a really good nap in the flight, watch a couple of movies, and then, you think after this movie, I'll start studying, and, finally dopamine kicks in a lot, but, maintaining adrenaline for a lot of time is difficult. So, but the extent of planning that goes in is really difficult, and somehow it works out at the end, but you end up doing only 20% of what you plan. And, in the beginning, I often felt that, you could be in your comfort zone and always achieve things, but that was not the reality. If you always worked with your comfort zone only, then you would never cross your boundaries and go beyond. So I had to take a step out of my comfort zone to do some things that I didn't like to do at that point of time. But then, yes, I started making a lot of notes which didn't make sense to me after even a couple of days. I couldn't decipher what short forms I use for the texts. So, and then this is something I treasure at the end of it. Normally people would, they all told me that, if you're dopaminergic, or most commonly people would take around a couple of years or 1.5 years to complete their USMLE exams. So I started in July 2019 and I started in April 2019 and I completed the last exam in July. So I completed this process in 4 months and I had decent scores. And again, I don't say this is success or failure or good for somebody or not good for somebody, but this is what I could do employing all my reserves of adrenaline gland. So I did this in 4 months, and this was a big plus in my interviews in US. So the next part comes is applying for your interviews. So if you looked at, if you go through your SF Maths process, you would have a lot of, every fellowship would go through a list of all the places where you can apply. If you register through the Maths process, you would have every institute where you could apply for a cornea fellowship or a pediatric ophthalmic fellowship, or all those things would be there. So you would have to go in and choose, and then finally you would know that at the end of everything, there are close to, out of say 50, 60 places, you would have close to 3 or 4 places or states where they would take in. You note down everything, you find out, you mail to each of them, and finally what you get is, hi, unfortunately due to credentialing reasons, we won't be able to take you. And after a lot of, somebody would write a bigger mail, somebody would take a long, a short mail to write that we are not interested in you. Other people would be really euphemistic and they would say, add a few more lines and then they say we are not interested in you. The only thing you can do for a long time is to write them back saying that thank you so much for your time, and we would stay in touch, and anytime there's an opportunity that comes up, please let me know. And that's how it keeps going on. But the only thing which I also mentioned in the previous panel discussion was that always try and look for where you can contribute rather than just extracting what you want. So in the places wherever I did my observership or research fellowships, I made sure that I called all the fellows, the residents there, and whoever is interested, and I taught them whatever I knew. So I would take in morning classes of early, management of refractive surgery complications, topographies, interpreting complex sabrometries, planning wavefront guided treatments, and whatever I could do from my side, I used to call them before their OPD started at 7. I used to call them at 5:30 in the morning, teach them for an hour, so that it's good for them also, and it's good for me that there is somebody. People would know that there is this person who is there who just doesn't want to take back something from this place, just wants to give something back to. And there you're, I also spent a lot of time without any money in my pocket, staying in dorms and paying for $6 a day. You can imagine how the condition would be in North America. And I met a lot of good mentors with whom I worked, and they helped me a lot, because without mentors, you cannot get through this process. Because every interview I attended, everywhere I went and spoke to people, my mentors, personally Dr. Ken Nischel, Dr. Vishal Janji, Dr. Rootman, they all called each of the places where I interviewed and spoke about me, and before the interview, after the interview. It's not that there are 40 candidates, 30 candidates who apply for one position in each of the places, and all Americans, and so they have their own funding, they have their own immigration, they don't need immigration, and obviously they wouldn't want to prefer somebody who is not in those sets of preferences. And still, because of mentors, I did get through. And having patience is most important in this process, because though I cut short, made the process much shorter than how much it would actually take, but still, having patience was really important during all that time. And coming to my understanding of how this journey is, it's definitely a race, it's definitely difficult to do. There is nothing called destiny. If somebody tells you that you are bound to get through because of this reason, that reason, don't believe in all that. Give your 100%. And the most important thing that deters us from giving our 100% is our own internal, the negative thoughts that we have about everything that we do. Starting from whether it's possible, starting from whether it's going to make sense at some point of time. So which is what I call as ants, killing ants. So this is from one of the famous philosophical speakers who says ants are automatic negative thoughts. So anything that you want to do, whether even from coming and sitting in this session, you would have 10 questions in your mind. Should I go to this session, or should I sit in some other session, or go and have lunch, or have a dessert and come back? Or the same thing goes on if you start your USMLE process or any process. You would have 100 questions in your mind. Will I be able to do it? What at the end of it? If there are close to 10 positions across USA and there are 100 people applying, will I still be able to make it? And all these things will prevent you from actually giving in your 100%. So if you are able to take all those thoughts out of your mind, and if I'm unemployed for a year, not earning for a year, sitting somewhere in US or Canada or somewhere else in the world, and trying to do something else that other people don't consider to be right at that time, just don't give any importance to that. You should know what you are going towards for. And there are so many other things that are out of your control. If another person is working as similar to yours and that person gets an external push, somebody else promotes him somewhere and he gets in, that's out of your control. So you can worry about only what things under your control. And be happy. This is my child. We had a child in March, and she motivated me to start this process in April. So be happy with your child, be happy with your family, and at the end of it, you need to be happy, you need to be motivated, you need to be focused. And before we go into the disclosures, so I would also like to show some aspects of, say, your application should have clear-cut career objectives, or what they call as statement of purpose. So they should have clear mention of what you're looking forward to from your fellowships, what your career objectives are, and what is your long-term plan. If you're not clear with these, nobody gives a damn look at your CV. And you should also be able to show your outside interests and hobbies, and which includes your teaching skills, which includes your video making skills, or anything that the institute, the person who's interviewing, can put into use. If he knows that you can make a really good video, he'll get you to make some videos for him for ASCRS, some conferences, and he'll win an award. So it's not about just telling them what you want to know. So I love babysitting is also something that I added in my profile. And if you looked at personal statement is something that's one very important factor that's looked up to for deciding whether they call you for an interview or not. And that has to be really planned. I took close to 1 week to make my personal statement with the word limit and everything. So it's about giving your 100% without worrying as to what the outcome is going to be. And yes, your CV can have a profile summary wherein you show salient 5 to 6 different points which tell the person who's reading the CV in a moment as to what kind of person he's looking at, what your training is, what your research interests are, what are your few awards, and what are your talents, how many have you presented, what have you done, and these things are some things. And then you show off your important research skill sets and your surgical skill sets. So this is what would give an overview of what you are, and then you can go on further. And looking at just the last couple of slides before Divakant comes closer to me. Yes, so the last slide would be on my disclosures. So financial disclosures, you would have listened to a lot of philosophy in this, and this doesn't just stem out of anybody. When you are in lack of money, you get spiritual, and when you have excess of it, you become philosophical. So money is something that financial disclosure was there in this presentation, which made me look at it from a different point of view. And the reality check is whatever I told, whatever plans I made, I could follow only 10% of them, but still I got to a position where I am currently, and my heartfelt gratitude to these people who guided me through this process. And I thank you all for my patient listening. Thank you.
That was a very comprehensive overview from a postgraduate or maybe from a fellow's point of view. Can you enumerate the number of centers, like you have gone through USMLE? Normally people do tend to have ICU fellowships and all. So can you enumerate some of the fellowships which we actually normally tend to do after, because sometimes people plan from post-graduation, like after ophthalmology, I'll take up a retina and maybe do a fellowship after that, or maybe a cornea, do a fellowship after that. So if you can enumerate, it's like if you are taking cornea, what sort of fellowships, or a generalized fellowship, or maybe a specialty specific fellowship.
Yes. So people in general tend to take in observerships in any place where they have a person whom they know. They apply for a fellowship, apply for an observership and get there. But yeah, I also went in like that for an observership initially. But what you need to consider, the salient points that you need to consider when you choose an ICO fellowship or an observership, is that you should apply it in a state which is open for international graduates. So if you apply for your observership in, say, the state of Arkansas or Texas, or in a state like, say, Pennsylvania or Washington, or there are only 3 states in the US currently which have openings for international graduates, which are, one is Pennsylvania, one is Texas, and the other is partially open is Washington, the state of Washington. So if you apply for observerships in other places, say Boston, say Illinois, say other places in the West or California, they would have a really good time with you. At the end of the observership, you would ask them, sir, is there any way I can apply for a long-term fellowship or here? They would say, we find you to be somebody really helpful, really knowledgeable, really pleasant, and we would definitely want to have you, but sorry, our state is not open for international graduates, so we would not be able to help you. So if you are planning something long-term, always look at these states which have an eventual possible opening for international graduates, be it ICO, be it observership, be it research fellowship, because you need people who are in that state to help you get into a surgical or a clinical fellowship and anything long-term. So this is one thing that is really important to consider.